is Alison Fox-Robichaud. I am a critical care specialist, an intensivist, and I am also a clinician scientist. By an intensivist, I mean someone who works in an intensive care unit, a critical care unit, a person who is trained to look after the sickest of the sick.
22nd of January.
It means that I have training and expertise in looking after patients on ventilators. It means I have training and expertise in looking at patients who have come out of bypass surgery and may require assist devices. It means I have expertise in monitoring heart pressures.
She came down yesterday and she didn't require intubation or BiPAP, just managed on supplemental oxygen, and she has maintained a reasonable oxygen saturation.
And a little chest physio.
And a little chest physio, yeah.
When the ICU is managed, run, and the decisions are made by ICU specialists, the patients do better, they survive longer, and they don't spend as long in the ICU. To care for the sickest of the sick means that you don't leave. Your responsibility is to them and to only to them.
How's your chest feel?
Good.
You take nice big breaths for me?
It may mean sitting at the end of a bed, asking the nurses to do something, trying to figure out what you can do next to make that patient better, but never leaving the end of the bedside for hours at a time. It means that you have special skills to put in lines, intravenous lines, monitors. It means stress. It certainly means stress because we have to deal not only with the fact that you may have somebody dying in front of your eyes and you're trying desperately to keep them alive, but it means that you have the stress of the family wondering what you're doing, whether you're doing the right thing. We do a really good job of preventing death with modern medicine. We can use life support, we can use drugs to support the heart. Sometimes that's not appropriate. And that's one of those challenges of being an ICU specialist. But it takes a while to convince families that that may be so, and for them to understand that death is okay sometimes. And so part of being an ICU specialist is dealing with death. For me, the hardest job is dealing with the young dying. That's the hardest thing for me. The motor vehicle accidents, the young trauma patients, the head injury patients, that for me is the hardest one. And withdrawing care, my colleagues say I do it well, that I can talk to families well, that we are able to interact well, but it doesn't make it any easier.
The team tells me that if that happened again, though, you would still want that breathing tube back in?
I don't think so.
No?
My body's been through enough.